Till now, we have discussed about fall risk assessment, causes, tools, fall risk assessment in hospitals and at home. The Today we will discuss about the Morse fall scale in detail. The Morse fall scale is quick evidence-based nursing tool used to identify a patient's risk of falling. It takes under 2 minutes, fits seamlessly into admission and shift assessments, and guide immediate prevention measures. I will walk you through each item, show you how to score it, and demonstrate a complete example. Here are 6 items of Morse fall scale and their standard score. You will score each item, add them up, and categorize the risk. First is history of falling. If there is no history of falling, then score is 0. And if there is presence of history of fall, then 25 score is given. That is within last 3 months or during current admission. Next point is secondary diagnosis. If there is no secondary diagnosis, then score is 0. And if there is secondary diagnosis or the patient has more than one medical diagnosis, the score is 15 to this point. Next is ambulatory aid. If there is no ambulatory aid or bed rest or nurse assist, then the score is 0. And if the crutches or cane or walker is used by the patient, then score is 15. And if there is furniture, then it is 30. Next is IV therapy or heparin lock. If there is absence, then score is 0. And currently has IV access, then score is 20. Next is gait or transferring. If the gait is normal or at bed rest or immobilized, then score is 0. And if gait is weak, then it is 10. And if it is impaired, then the score is 20. Last is the mental status. Oriented to own ability, the score becomes 0. And overestimate or forget the limitations, then it is given as 15. Risk categorized as 0 to 24 is low, 25 to 44 is moderate, and more than 45 is high. Step-by-step bedside workflow. Use this simple sequence using admission or routine rounds. Let's score a typical medical ward patient to see how this works in practice. Suppose there is a patient of age 76 years admitted with pneumonia and hypertension. She reports a fall at home 2 weeks ago. She has an IV cannula in situ. She uses a walker but sometimes grabs furniture. Her gait is hesitant and short-stepped. When asked, she says, I can go to bathroom by myself, despite needing assistance. So how will we score this? First one, there is history of fall. Then the answer is yes, then we will give 25. Next one is secondary diagnosis. As the history tell, pneumonia with hypertension. So the score become 15. Third one is ambulatory aid. The patient use walker. Then it becomes 15. Next is IV therapy or heparin lock. That is, patient has IV cannula in situ. So the score become 20. Next is gait and transferring. The gait is impaired. That is, the patient hesitate and use furnitures. The score become 20. And the mental status. She used that much to walk and still she is saying I can go to bathroom by myself. So she is overestimating her ability. The score given is 15. So the total score calculation is adding up all, that is 25 plus 15 plus 15 plus 20 plus 20 plus 15, that is 110. So it is more than 45. So it will be in the category of high risk. She is at high risk of fall. Immediate action to note in plan of care is high risk signage or wristband, call bell within reach, bed in low position with brakes on, non-slip footwears, scheduled toileting, supervised ambulation, walker at bedside, clear pathways, adequate lighting, educate the patient and family, and document the score in the chart with reassessment plan, the total, the risk category, and the specific fall prevention intervention you initiated. Reassess at admission, at every shift change, after a fall, and whenever there is a change in condition or mobility. Consistent use of Morse fall scale ensure timely prevention and safer care environment. The Morse fall scale is fast, practical, and clinically powerful. By scoring these 6 items and acting on the result, you turn a quick bedside check into meaningful fall prevention. Make it a part of your routine. Assess, document, and intervene. Thank you for watching. Like, share, and subscribe.